As everyone knows, 19th century London was a clean and hygienic place. In 1854, London was by all accounts a proper Victorian metropolis, but it was still making do with public infrastructure from the Elizabethan era. Things we take for granted today, like public health departments and sewage systems, simply hadn't been invented yet. So the ever-so-virtuous British people began to take full initiative, casually tossing their garbage and excrement everywhere. In the process, they even created an extremely popular profession, the night soil man. Because collecting night soil was a high-risk job, it was easy to fall into a cesspit and drown. It became increasingly expensive, so the kindly British people began to get even more casual about tossing their garbage and waste into their own yards, or their neighbors' yards. A 19th century civil engineer recalled that when passing through the entryway of the first house on a block, he found the yard covered in human waste that had overflowed from the privy, forming a layer 6 feet thick. The yard was paved with bricks so that the residents could cross it without getting their feet wet. In short, London in that era had a very powerful aroma. The Great Stink of London in 1858 was the grand climax, with all these various buffs. In effect, by the 19th century in Britain, pretty much the entire population had already gotten a sneak preview of allergic rhinitis. It's just that, compared to deadly diseases like cholera and tuberculosis, its impact was slightly downplayed. But the misery that rhinitis causes a person has always been truly miserable. Hello everyone, I'm Jun Tungguo. Today is National Love Your Nose Day. To put it in your nose's own words, hey you little devil, it's about time you paid some attention to your noses. Knowledge and health, don't you think? As the saying goes, spring is here, everything comes back to life, and so does rhinitis. In this season of revival, it's not just the animals that are getting busy. The flowers are also competing to bloom, and rhinitis is especially eager to join the party. So, in this video we're going to talk about rhinitis, especially allergic rhinitis. We'll do a deep dive into the basics, its causes, how to find relief, and why it's so hard to treat. Our goal is to help our friends who are suffering to fully understand this condition. Also, a lot of work went into making this video, so we hope all you wonderful people watching will show some support with a like and a follow. Thank you all. For someone with rhinitis, every breath feels like a battle for survival, a hard-won opportunity. Breathing freely becomes a luxury. When you're out and about, the thickness of the stack of tissues in your bag directly determines your sense of security. After all, there's a special kind of desperation in having to split one tissue into 4 pieces. The non-stop river of snot, the endless barrage of sneezes, plus an itchy nose, itchy eyes, and a stuffy nose that keeps switching sides. It all makes you want to just give up on your nose and drop dead on the spot. And trying to sleep at night, that's a whole other level of torture. It's already hard enough to fall asleep when you feel so miserable. Then just when you finally doze off, you're jolted awake, unable to breathe. If this state continues for a long time, it's enough to make you completely lose your mind. The nose is the organ specifically responsible for breathing. Its main function is to filter the air we inhale, which is something the mouth can't do. The air might look pure, but its composition is actually very complex. It's not just oxygen, it also contains dust mites, bacteria, viruses, allergens, and all sorts of other harmful substances. You can't judge air by its appearance, and that's the truth. To ensure that the air delivered to the lungs is clean, the air is relatively clean the moment air enters your nostrils. The filtering process begins. The nasal cavity, which consists of the nasal vestibule and the nasal cavity proper, is the main passageway for air to enter the lungs. The nasal vestibule is filled with long nose hairs, which block large particles from the air you inhale, thus completing the first stage of filtration. The boogers we're all familiar with are a product of this stage. Next, the air moves into the nasal cavity proper. The inner surface of the nasal cavity is covered with a mucous membrane, which is waiting right here for the air to arrive. The goblet cells and ciliated cells within the mucous membrane are responsible for humidifying and purifying the air respectively, giving the air a deep clean right here. Goblet cells secrete various mucoproteins. They can humidify and warm the air while also trapping dust, microorganisms, and other impurities. The ciliated cells are in charge of the cleanup. Their surfaces are covered in cilia. These cilia are coated in the mucus produced by the goblet cells. As the cilia sway back and forth nonstop, they form a mucus blanket that moves at a rate of 5 millimeters per minute, trapping the dirty stuff in the air. Imagine those automatic car washes that cost $10. Those big flapping brushes are your nose hairs. The water being sprayed is the mucus, and your car is the air. In the end, all this gunk is sent to the nasopharynx in the form of snot. Some of it becomes phlegm that you spit out. The rest is swallowed and left for your stomach acid to handle. Under normal circumstances, snot can be properly processed by the body. It's only when there's way too much of it that it starts running out of your nose. However, if the foreign invaders in your nasal cavity are particularly strong, or your own immune system is weak, or you have allergies, or perhaps if you're stressed or overworked, causing a nervous system dysfunction and so on. So, at this point, the environment inside your nasal mucosa changes, and the protective barrier in your nasal passages gets damaged, which can then develop into rhinitis. Rhinitis is an inflammatory condition of the nasal mucosa caused by a variety of factors. Broadly speaking, there are many causes of rhinitis. Local factors include viral and bacterial infections, allergic reactions in the mucosa, and pathological nerve reflexes, among others. Systemic factors include chronic diseases affecting the whole body. On top of that, excessive smoking and drinking, chronic fatigue, and even endocrine disorders can lead to rhinitis. The incidence of rhinitis is extremely high. Some reports claim that the prevalence of rhinitis in China is as high as 10% of the total population. In theory, people of all ages, both men and women, will be troubled by it at some point in their daily lives, either for a short time or for the long term. The classification of rhinitis isn't very standardized, and the categories you find online are all over the place. Here we'll explain the classification of rhinitis based on a consensus paper from the Chinese Journal of Otolaryngology, Head and Neck Surgery. The classification of rhinitis, based on its duration, inflammatory nasal diseases, can be divided into two main categories, acute and chronic. Chronic rhinitis, in turn, is further classified based on the type of mucosal inflammation into three main categories: allergic rhinitis, non-infectious, non-allergic rhinitis, and infectious rhinitis. Allergic rhinitis is divided into seasonal and perennial types. Non-infectious, non-allergic rhinitis can be categorized into vasomotor rhinitis, drug-induced rhinitis, gustatory rhinitis, and so on. Acute rhinitis and infectious rhinitis, on the other hand, are usually caused by infections from pathogens like bacteria or viruses. Let me just add something here, because the types and mechanisms of rhinitis vary so widely. Different types have different treatment plans. For any of my friends out there who feel like something isn't right, be sure to see a doctor promptly to get a clear diagnosis. Remember, don't try to be your own doctor. You'll only end up hurting yourself. One of these types is non-infectious, non-allergic rhinitis, such as vasomotor rhinitis, which is mainly related to a dysfunction of the autonomic nervous system. The lining of your nose is filled with sensory nerve fibers. Once they are stimulated by things like dry, cold air, irritating gases, or even emotional fluctuations, the nerve endings of the affected person will release neurotransmitters like acetylcholine or neuropeptides. This in turn causes a series of inflammatory symptoms in the patient's nose, leading to vasomotor rhinitis. As for infectious rhinitis, it's generally caused by the invasion of pathogens like viruses or bacteria, which triggers the body's innate and adaptive immune responses. This leads to neutrophil accumulation and T-cell activation, causing inflammatory cytokines and toxic proteins to be synthesized and released, which results in rhinitis. Allergic rhinitis, which in most medical textbooks is called allergic rhinitis, is what's known as an allergic disease that occurs after the mucous membrane comes into contact with an allergen. The technical term for this is a hypersensitivity reaction. In Chinese, the term literally means abnormal reaction. But it's not what you think. It refers to a situation where after the body's initial response to certain antigens, it's stimulated by the same antigen again. This triggers a specific immune response that primarily involves physiological dysfunction or damage to tissue and cells. This is also known as a hypersensitivity reaction. It's like the hives that we sometimes get. That's a type of hypersensitivity reaction. As we all know, for an allergic reaction to happen, three conditions must be met: a specific antigen, a specific individual, and fate bringing them together. In 1963, Gell and Coombs classified hypersensitivity reactions based on their speed of onset mechanism and clinical features, dividing them into four types. Type 1 hypersensitivity reactions and Type 4 hypersensitivity reactions are the most common. Among them, Type 1 is an immediate type hypersensitivity reaction, also known as an allergic reaction. The true nature of allergic rhinitis is actually a Type 1 hypersensitivity reaction. The so-called specific antigens are what we refer to as allergens. And specific individuals are people with an allergic constitution. Compared to people without this constitution, they are more prone to developing allergic rhinitis. Unlike the common cold, a cold is usually accompanied by a sore throat, a cough, and other symptoms. Severe cases might also involve a fever, headache, or even body aches and nausea. On the other hand, allergic rhinitis' typical symptoms are sneezing, a runny nose, an itchy nose, and a stuffy nose. It's often accompanied by things like itchy eyes. Next, we'll break this down from three perspectives: allergens, the allergic constitution, and how their encounter leads to the onset of the condition. seeing as how the creator put so much heart into this, giving a free like isn't too much to ask, right? I've basically become a monk just to ask for likes. Not that I have such worldly desires. First, the allergens. The various factors that cause allergic rhinitis are called allergens or antigens. Allergens aren't actually some terrifying substance. In fact, they're everywhere. Common allergens include inhalant allergens, which are also the main type of allergen. First and foremost is pollen. The pollen that causes hay fever has an average diameter of 20 to 50 micrometers, which can almost all be captured by the nasal mucosa. The plant pollen that causes the condition is mainly concentrated in the spring. During the summer and autumn seasons, the climate is also closely related to hay fever symptoms. Dry, windy weather can increase the amount of pollen in the air, so patients' symptoms are more severe. Rain can wash the pollen out of the air, so symptoms are milder. However, flowers that are vibrant and fragrant like roses rarely cause allergic symptoms. That's because their pollen is heavier and stickier, making it difficult for it to float in the air for long. Next up, we have fungus. There is an enormous number of fungal species, somewhere between 100,000 and 250,000. Obviously, if you were to gather them all into one big pot of soup, you'd create a magical fungal broth valley. Its magic lies in its ability to send your body and spirit on a wonderful journey. The types of fungi that cause allergic reactions number between 20 and 30, but the number of fungal spores floating in the atmosphere is far greater than the number of pollen grains. They are everywhere all the time. Not only can they be inhaled through breathing, they can also enter the human body through various other ways, such as ingestion and direct contact. Mites are another extremely potent allergen. The skin flakes and waste products of live mites both have allergenic properties that can affect patients. They are commonly found in dust, especially in beds, pillows, carpets, and curtains, where they can come into close contact with people. In addition to this, pets' fur dander and saliva all have allergenic properties, and dander is even more allergenic than fur. So for all you cat and dog people out there, you need to pay attention. Besides inhalant allergens, there are also food allergens and contact allergens such as seafood, eggs, milk, peanuts, cosmetics, paint, and so on. It's worth noting that these allergens can also cause allergic rhinitis. Now that we've covered allergens, let's talk about having an allergic constitution. After all, it takes two to tango. The so-called allergic constitution refers to cause allergens that don't affect normal people to also produce a specific allergic substance called EGE. This is a genetic predisposition. Research shows that an allergic constitution is strongly related to a patient's genes. When both parents have an allergic constitution, the prevalence of this trait in their children is as high as 75%. And if only one parent has an allergic constitution, the prevalence rate can still be up to 50%. Sometimes it's also found that people who didn't have allergies before can, under the influence of certain specific factors, transform into having an allergic constitution. You were perfectly fine, but then you get an upper respiratory infection one time. Maybe a virus or bacteria is the culprit, which stimulates your tissue cells and triggers an allergic reaction. Furthermore, in recent years, due to the acceleration of industrialization, factors like air pollution and furniture may cause people who originally didn't have allergies to develop them. However, to comfort all you sweethearts with allergies, I went out of my way to look for some benefits of having an allergic constitution, and someone actually found some. All right then. They really did. I'm crying. Put this on the screen. In a paper published in 1969, there was a theory that people with allergic constitutions are less likely to get cancer. The first paragraph of this paper says, in a survey conducted in the gynecology ward of a large general hospital with 140 patients, the subjects were asked whether they suffered from any common hay fever-type allergies. As a result, 20% of them answered that they suffered from such allergies. Surgical and biopsy reports from this ward's population determined the incidence of malignant disease to be 28%. Among people of similar ages, these two conditions were actually mutually exclusive. Mutually exclusive means that none of the people who had allergies got cancer, and people who get cancer are never people who have allergies. Of course, the author did say this is just a possibility. You should just think of it as a form of positive thinking. So what happens when an allergen and a body prone to allergies meet? All right, we're getting into the heavy science now, so don't fall asleep. When an allergen enters the body, the nasal lining of a person with allergies produces a type of antibody called IgE. This IgE firmly latches onto the mast cells and basophils on the surface of your nasal lining. At this point, our body mistakenly thinks it's already geared up to fight the enemy. The technical term for this is that the body is now in a sensitized state. When that same antigen invades the body again, it triggers the cells to degranulate. Degranulation is basically when these cells release substances like histamine from their granules. Histamine can cause surrounding blood vessels to widen and tissues to swell. Histamine can also increase the permeability of blood vessels and ramps up activity in the exocrine glands. It's the main culprit behind allergic rhinitis. This is also the key reason why patients get a swollen nasal lining, a stuffy nose, and an extremely runny nose. When the nervous system in your nasal lining detects histamine, it immediately sends out an itchy signal. This immediately activates super transformation mode. You take a deep breath, your soft palate drops, the back of your tongue rises. Your abdominal muscles and diaphragm contract violently, which then produces an extremely fast and powerful exhale. In plain English, you just sneezed. A sneeze itself is a protective reflex of the body, mainly meant to quickly clear irritants from the nose. It's just that the sneezing caused by rhinitis is just way too much. It's unbearable. Rhinitis is so tough, so what should I do? Now, due to some sensitive factors, I'll only explain the basic principles. The principle behind how corticosteroids work is by suppressing the immune response and the inflammatory reaction to relieve symptoms. And as for antihistamines, they also relieve symptoms by suppressing the immune response and the inflammatory reaction. And antihistamines work the exact same way. The basic principle of antihistamines is that the drug binds to H1 receptors, quickly exerting a competitive blocking effect. This blocks the nerve-ending reactions caused by histamine or the vascular reactions, which reduces itchiness in the nose, sneezing, and relieves congestion. As for decongestants, they are alpha-adrenergic receptor agonists, which can cause the smooth muscles and blood vessels to contract, reducing the production of local tissue fluid, and thereby relieving symptoms like a stuffy nose. So what about desensitization? To put it simply, it's about injecting the substance you're allergic to into your body in gradually increasing concentrations. This allows your body to slowly adapt and produce IgG antibodies. The next time you encounter the allergen, the IgG will compete with the troublemaking IgE, thereby reducing or preventing an allergic reaction. But for chronic allergic rhinitis, the most crucial part actually lies in your daily self-management. In other words, daily relief and prevention. First, you need to figure out your allergens and then intentionally avoid contact with them. If you can go straight to the hospital and have a doctor help you out. Generally, you might be allergic to one substance, or it could be multiple things, which is the case for most people. If you don't want to go to the hospital, then you'll have to look for clues in your everyday environment. You'll need to be very observant. For example, pay special attention to your surroundings and objects when your symptoms are particularly bad. If you really can't figure it out on your own, then you should still seek a doctor's help. Never avoid the doctor out of fear or just stick to your own stubborn ideas. Another thing is nasal washing. On this topic, I did a little digging, and some of you said it works wonders, while others said it's useless. So what's the real story? Well, the air we normally breathe contains a lot of dust, bacteria, sulfur dioxide, all sorts of pollutants and viruses. As the gatekeeper, your nose is constantly under attack from dirty air, and while the lining of your nose has some filtering and cleaning abilities, it has its limits. But if you rinse your nasal passages, you can clear out all the gunk and scabs in time. This helps your nose do a better job at filtering and cleaning, boosting your body's resistance against viruses, bacteria, and allergens. Scientifically, this all checks out. Rinsing your nose with a saline solution is one of the few safe drug-free methods that can effectively relieve uncomfortable symptoms. It's also an effective supportive therapy recommended by doctors. The basic principle is using a saline solution to wash out the mucus and external irritants from your nasal passages. This reduces the local inflammatory factors, lessens the swelling of the nasal lining, and in turn improves nasal airflow and drainage, as well as the function of the tiny hairs in your nose. But the lining of your nose is also a delicate area, and it's easily damaged if you're not careful, which is why when you're doing a nasal rinse, the amount of pressure is incredibly important. Whether you're using a turbocharged or a manually pressurized device, you should always go with what feels comfortable for you. Besides, the whole concept of nasal rinsing is still pretty new to most people, so actually doing it can be a bit challenging. The relationship between exercise and allergic rhinitis is easily overlooked by people, but it's actually an effective measure for preventing and treating allergic rhinitis. Research has found that consistent aerobic exercise can increase blood circulation, reduce nasal airway resistance, and improve the regulatory ability of organs affected by allergies like the nasal passages, sinuses, and lungs. An important factor in the development of allergic rhinitis is that the patient has an allergic constitution. Exercise not only boosts the body's immunity, but also has the potential to change a patient's predisposition to allergies. Maintain a regular lifestyle and stick with your exercise routine, and you might find that something unexpected and wonderful happens. But it's important to note, you must not over-exercise. Exercising at a moderate intensity for 30 minutes to an hour and sticking with a to long-term is already excellent. Here's a way for you to gauge your own exercise intensity. It's called rating of perceived exertion. Basically, as the intensity of your activity increases, how you feel will go from very light and fairly light to somewhat hard, and eventually to very hard. During exercise, if you feel a little tired, you've actually already reached the required intensity for aerobic exercise. In other words, for those of us who aren't trying to win a gold medal, a little tired is good enough. This way, it's not only easier to stick with, but it also won't put too much strain on your body. Paying attention to your living environment is another thing that's easily overlooked. I mean, we're all a little lazy, right? But what can you do when your nose is so high maintenance? Keeping your home well ventilated, clean, and tidy is a must. A messy living environment not only increases the dust in the air, but it will also invite unwelcome guests like cockroaches, mold, spores, and other allergens, which will just worsen your allergic reactions. Your bedding in particular should be changed frequently, and you should get rid of dust mites regularly. After all, this is what comes into contact with your body the most closely and the most often. Dust mites are the #1 indoor allergen. So if you don't want to walk around with a red nose all day, you need to take the threat of dust mites seriously. For patients who love pets, especially those with adorable cats, I have a serious recommendation: send them to me. I'm willing to take on that burden for you. When you go out, always keep a mask in your bag. In places with poor air quality or in crowded areas, wearing a mask is also very important. A 4-layer gauze mask can effectively block 90% of bacteria. I'm sure you've also heard the claim that washing your face with cold water can cure rhinitis. At first glance, this sounds a lot like a myth, so I made a point to look it up. From what I gathered, washing your face with cold water can indeed stimulate the sympathetic nerves along your face. It constricts the blood vessels, which can temporarily relieve nasal congestion. But the effect is limited, and it doesn't provide any long-term anti-inflammatory benefits. So it's best to use it with caution. Overall, allergic rhinitis is an extremely common global health issue. According to a CCTV report from last year here in China, the number of allergic rhinitis sufferers is close to 250 million people. The mechanism that causes allergic rhinitis is complex. It can't be explained by a single factor. It's a disease involving multiple factors in the stages. At our current level of medical science, we still can't change a person's allergic constitution to a non-allergic one. What's more, it's practically impossible for us to completely avoid all allergens. That's why there's always a risk of it flaring up again and again. And this brings up a very critical issue. It can progress into asthma. You can't just let allergic rhinitis run its course. Data shows that if it's not managed in time or its progression isn't slowed, about 40% of allergic rhinitis cases will develop into bronchial asthma. This is a very serious problem. Therefore, taking proactive self-care steps in your daily life, like getting into the habit of nasal rinsing, combined with long-term management under a doctor's care, can slow down the flare-ups of allergic rhinitis. All in all, this is a reliable path to take. All right, that's all for this video. I'm Junjang Guo. Follow me. And stay tuned for more great content.